As the country continues to prepare for the coronavirus outbreak that has so far affected more than 80 countries, these efforts will be hampered to what key industry players in the sector term as a looming drug shortage.
As such, India cannot be able to export the finished pharmaceutical ingredients, the finished pharmaceutical products, not only to Kenya, but to other countries in the world. As such, there is a shortage that is looming.
We want to request the government of India, please consider us. Yes, let us not ban, even if you have to ban to other countries, like in the importation of these drugs to Kenya.
Kenya Pharmaceutical Distributors Association have said that the country stares the crisis in the coming days if the Pharmacy and Poisons Board do not import medicine from other countries.
But these shortages, the way they are coming up is that prices are the ones who are going up. Already the prices of some common generics have actually gone up by more than 50%. And obviously this comes up because of the loss of demand and supply. You have your own stocks, and stocks prices out of your country have gone up.
The country imports about 70% of its medicine, while 30% is locally manufactured. Kenya majorly imports from China, and the country is currently in lockdown following the coronavirus outbreak.
Since the outbreak of the coronavirus, the economies in countries such as China has actually ground to a halt, and they are no longer manufacturing the active pharmaceutical ingredients. And as such, countries who import the active pharmaceutical ingredients from China, such as India, are not in a capacity to import them, and in such they are not in a capacity to manufacture several pharmaceutical products. Kenya, we import literally 80% of the pharmaceutical products we use or we consume in this country.
Chief Administrative Secretary Rashid Aman has insisted that they have enough commodities to deal with the virus.
Now what we are requesting is that our government must allow our country to import from other countries as long as those countries meet the requirements.
Some of the things that we need to consider is, as part of our preparedness, is that we have the necessary commodities to be able to contain this outbreak. We have not recorded any positive case of COVID-19.
The ministry has also been urged to halt the supply of locally produced medicine to neighboring countries so as to cushion the country in the coming days. Meanwhile, the Pharmacy and Poisons Board has launched its third strategic plan 2020 to 2025, which costed 12.5 billion.
I also want us to give a copy.
The board is expected to raise 2.3 billion per year in the next 5 years. Updates is Ashimi, Brew TV.